More on the Ebola outbreak, I spoke to Kathryn Jacobsen. She is a professor of Epidemiology and Global Health at George Mason University in Virginia. I asked her what led to this latest outbreak.
This has been unraveling in slow motion for several months now. And what's happened recently is it started to spread into new districts. And it started to move into more urban areas, also closer to the border with Uganda. And so the more places where it's located, the more we have to work to try to stop transmission. And so as we've seen the footprint of where Ebola is happening enlarge, the concerns have gotten much more heightened.
And of course, you mentioned more urban areas. That's a bigger challenge to contain.
That is a much bigger challenge. Part of what we saw with the West Africa outbreak was that, first of all, it crossed a border and then it moved into more populated areas. In the past, in the Congo, it's always been in very remote areas. And so some villages were heavily affected and then the outbreaks ended. Once it starts moving into urban areas, it becomes much more complicated to contain. And again, the real concern here is that it could cross an international border. When it crossed the border in West Africa, that really complicated things, in part because the affected countries didn't speak the same language. So an English-speaking and a French-speaking country in that situation, or here between Congo and Uganda, that we would have those similar communication challenges. So World Health Organization is very actively working with the health officials in Congo to try to contain this. But this is an international concern because of where it's located.
And also because there's a war going on. It can't be easy to contain this in the midst of all of that.
Right. So the typical way that we would try to contain Ebola is by going community to community with health workers doing surveillance, trying to find every case, and potentially vaccinating contacts as well. In a place where there's a lot of violence going on, it's not safe for community members to go to a hospital, and it's not safe for public health teams to go out into the community. And so the tools that we have to try to contain this through public health are really limited.
So what's the long-term prognosis, at the risk of using a medical term here, of how long this could go on?
At minimum, it's going to go on for months, and that's the best case scenario. What we're worried about is how quickly the cases could explode. How much more could we see a growth in where this is occurring and how many people are affected. There is a vaccine that is a candidate vaccine, so it's not formally approved yet. But even if that's 100% effective, and even if we could get more doses, there's a real shortage right now. Even so, we have to be able to reach people with the vaccine.
Before they're infected.
Before they're infected.
Okay.
And so if we don't have the security to be able to get vaccine to the people who need it, it doesn't matter if we have this wonderful new technology that's available.